Welcome back to the Move Better project. Today, we're gonna work on some of the deep muscles of the lower leg with something I call the posterior tibial smash. You have two calf muscles, the big gastrocnemius, which I can see here, this deeper calf muscle called the soleus, and then underneath that, there are three deeper muscles. Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. These three muscles all have tendons that pass behind the medial malleolus, which is this bone right here, and then attach either onto the bottom of the foot, the base of the big toe, or the other four toes. Combined, they have an action that plantar flexes the foot or straightens the toe, and then pulls the sole of the foot inward as well as flexing all the toes. When these muscles are stiff, they can limit both dorsiflexion with the knee bent, so the ability to get the knee forward. Obviously, that could be a big factor if you struggle to get deep into a squat. They also can contribute to dysfunction on the bottom of the foot. So if you suffer from plantar fasciitis, this one is definitely for you. For my pre-test, I'm gonna get down into a deep squat. And I wanna feel how much I'm able to both drive my knees forward as well as press them apart, getting down into this position. For the mobilization itself, I can either use my thumbs, a lacrosse ball, or my elbow, or really any firm surface. The spot we're gonna work on is about halfway down the tibia, just behind the tibia. So if I can find this bone here, the tibia, that's my shin on the inside surface, there's gonna be a shelf that I can kind of drop off. I wanna be just behind that. And if I'm using my thumbs, I can just press in, I can get in here with an elbow, or I can use the lacrosse ball to put in pressure. The lacrosse ball is nice because I can put in pressure and then twist it to take up a little bit of the slack. Once I've got a piece of tissue that feels like it's sensitive, and for most of you, this whole area is gonna be really, really tight and stiff, I wanna apply some pressure and then just take a few deep breaths. As I start to get comfortable, I can get this ankle into a more stretched position for these muscles. So to stretch this, again, I wanna dorsiflex and evert, or turn the sole of the foot outwards to stretch those medial shin muscles. Apply pressure, twist, breathe in, exhale, get a little deeper into a stretch. From there, I can contract, relax. Breathe in, point my toe, bring the sole of the foot inward, breathe out, dorsiflex, and evert the sole of the foot. I'll do a few more cycles of that. And you can find any position along this medial shin that feels like it needs work. And it doesn't really matter what muscle you're hitting. Maybe it's flexor digitorum longus. Maybe it's medial fibers of the soleus. The point is, all of these tissues are going to be stiff and restrict those movements of dorsiflexion and eversion that we need to do a squat and lots of other functional movements. I can also get in here with my thumbs, press down in, and then press forward against the tibia and really pin some of those medial muscles. Ooh, just feels absolutely awful. Now that I've worked on this left ankle a little bit, let's see what my squat looks like. I can tell that I'm much more easily able to get my left knee out in the squat, and there's a little less resistance to driving the knee forward as I get deep into the position. So give it a try. Posterior tibial smash, you got plantar fasciitis, medial knee pain, Achilles tendonitis, whatever it is, this will help you with stiff feet and ankles. Give it a shot, leave a comment below, let me know how it goes, subscribe to the channel, and we'll see you next time.